I'm Tammy Olivier. I'm an occupational therapist. Occupational therapy is a very broad yet very scientific approach to treating patients of all ages. Occupational therapists work with a wide range of patients, everything from a neonate, a premature baby in a hospital, in a NICU setting, all the way through to the end of life palliative care. And we generally look at rehabilitating people with any physical, cognitive, or mental disability or disorder. Occupational therapists are really skilled at identifying and removing barriers within the environment, and that can be a physical barrier within your home to prevent a fall. It can also be a social or emotional barrier, so people who are maybe struggling with mental health concerns or cognitive disorders, we help and we rehabilitate them to be able to get back to their independent tasks. When an occupational therapist meets a person for the first time, we ask a range of seemingly weird questions, and we really delve into what a person does every single day, and we focus primarily on their activities of daily living. And those can be the most basic activities to your most complex things. All of those things impact on a person's ADLs, and our job as an occupational therapist is to work on the different components of your body to be able to get you to be doing your ADLs independently and safely. What makes occupational therapy different from, for example, physiotherapy is that we view a person not just as their physical body, but as a person who has a brain, a soul, a spirit, who works in a context. We view them as a holistic person. Parts and parcel of what makes occupational therapy so unique is that we look at the person in their context, occupations, what is meaningful for that person. We work very client-centered. In other words, what is important for the client is important for us to help them achieve, because those are the person's goals. Not only do we as OTs do a lot of skills training and skills development with a wide variety of patients, we also do a lot of education. A large portion of our population in South Africa has very poor health literacy. So understanding how your body works from the basics to explaining complex neurochemicals to a chronic pain patient, for example. We do a lot of education. It's part of our treatment, because the more a person knows about what's going on, the more they are empowered to take control and to actually improve their quality of life and to gain their independence levels back. When an OT is part of a team, we have a very good understanding of all the different facets of the different team members and what each profession can bring to a specific patient. When we interview a patient or start assessing a patient, we start picking out what elements of their functioning needs assistance. And by doing that, we also then link them with a specific profession to give them what they need at that time. And the occupational therapist is the most skilled at identifying what are those concerns, what are the elements of this person's functioning that need to be addressed. And at Pain, we are fortunate to have a wide variety of other healthcare professionals that we can enlist as needed for specific patients. We also have more than one. So when a patient is perhaps needing a male input rather than a female input, we have that person for them. And that makes it amazing to be able to do that, to be able to say, we need this person, we need that person for this patient.